So I recently left my career as a surgeon, and I wanted to share that the primary reason I did that is because of moral injury. I love how Wendy Dean describes moral injury in her book, If I Betray These Words, as all of the responsibility and all of the accountability, but none of the autonomy. And that really resonated with me because that just captures exactly what I felt like. I felt powerless. I wanted to prescribe a very cheap medication to my patients like budesonide, and their insurance company would deny it, and the pharmacy would tell them it would cost them $300. And I couldn't tell which patients had the insurance that would do that and which ones didn't. That's just one tiny little example, but multiply that by thousands and thousands of encounters, of interactions, of trying to either prescribe a medication or prescribe a treatment plan or do a surgery, and to just be met with roadblocks and layers of bureaucracy that are quote unquote meant to keep, healthcare costs down or a patient safe, but really don't. They just drive a wedge, multiple wedges between the physician and the patient. And when we keep layering in these roadblocks, preventing the doctor and the patient from having an actual relationship, that's when we make mistakes. And so how do we fix this? We got to get business out of medicine. Healthcare needs to go back to relationship building, to trust between the physician and the patient. They need to be put on the pedestal. We need to start there, not with the shareholders, not with all of the bureaucratic tasks that are meant to keep patients safe, but just increase costs.
All right, that was really tough to watch for me as a physician that's so passionate about practicing medicine and taking care of patients. But the real hard truth is that Dr. Mel Thacker, although she took an extreme approach by completely leaving the profession secondary to what she calls moral injury, I think that she was suffering from really severe burnout. The truth is that so many physicians are feeling this way, and I'm speaking about this loud and clear. The loss of autonomy of U.S. physicians is a huge problem, and it is the number one cause leading to burnout. Fully 50% of physicians at least admit to being burnt out, and it's worse among women, where some, are pushing 60% in some surveys. It is a huge problem because, again, a burnt out physician is not going to be capable of delivering the type of healthcare that we want to see. Yes, they're trying their best, but it is absolutely human nature that if you are feeling very burnt out, this is where things can go awry. Apathy arises, mistakes can be made, other things can happen. So it's really important for us to address this elephant in the room of burnout. We've got to make changes. We've got to understand that the bureaucracy and the corporatization of medicine, as well as insurance companies practicing medicine, us having to fight constantly through things that have nothing to do with the personal relationship between us and our patients and us trying to make them better, really has to be addressed. It has to be addressed by us as physicians, it has to be addressed by you as the consumer, and it absolutely has to be addressed at the congressional level, because changes need to come, or I am telling you, we are going to be in a lot of trouble. We need to focus again on preventative health, root cause treatment of all of these diseases that are inflammation based. And we need an army of dedicated and non-burnt out physicians that can deliver the absolute best healthcare to the American public. I talk about this very openly in my book, and I'm excited for that to come out. But I sympathize with Dr. Thacker. I am Again, heartbroken that she has left the profession, that so many are thinking of leaving the profession that I love so much, and the changes need to be made. So let us know what you think about what Dr. Thacker is going through, her fact that she's left medicine. Leave that all in the comments, and let us know how you feel about the status of American healthcare and what we need to do as physicians and as lay public to make things better. Hopefully this helps. We'll see you on the next video.